Right now, we're going to turn to a panel discussion on lupus, patient-centered advances in treatment and education. And we are delighted to have our moderator, who is Dr. Alok Patel, who is pediatric hospitalist at the Lucile Packard Children's Hospital, special correspondent to ABC News, pediatric content advisor to Medscape, host of Nova Now podcast at PBS. On our panel is Dr. Janine Austin Clayton, NIH Associate Director for Research on Women's Health and Director for the Office of NIH of Research on Women's Health. Sherrita Dorsey, who is a Senior Director of Advocacy and Patient Engagement Specialty Business Unit at GlaxoSmithKline, and Wendy Rodgers, who's the Director of Care and Support Services at the Lupus Foundation of America. So Dr. Patel, I'm pleased to turn the program over to you.
Mike, thank you so much. I hope everyone can hear me appropriately, given my background in broadcast and production. Audio and lighting is paramount for me, so hopefully there are no issues there, but I'm honored to be here and to talk with this expert panel about a condition that touches millions of people across the world, if not you directly, likely someone you know, someone you're associated with. Now, simply put, according to a 2018 report, over half of US adults, it's about 130 million people, have one or more diagnosed chronic medical conditions. This equates to a huge burden on quality of life for so many people, including billions, in some estimates, trillions of dollars in healthcare funding. Now, most chronic diseases affect women disproportionately, and multimorbidity, or having two or more of these chronic diseases, is actually really common. Now, among Americans with chronic conditions, more than half have two or more such conditions. We mentioned that it's more common in women than men. And there is an especially heartbreaking disparity among patients from underserved racial or ethnic populations. This is something that all of us see if you work in any aspect of healthcare. And I will tell you, as someone who went through medical school, we used to refer to lupus, one particular chronic condition that's autoimmune, as the great imitator because of its ability to emulate so many other diseases. And this just adds to the burden for people who have trouble accessing reliable healthcare and getting a diagnosis and getting the treatment when they can. So with that being said, I am extremely honored and personally excited for today's panel, where we're going to address two parts of the spectrum: research and education, the two-pronged sword that we need to see true progress in treating lupus and all chronic conditions. What's new? We want to talk about lessons learned and where the gaps may still be, so we know where to address our resources and attention. So for research, it takes more than just one singular approach. It takes both a public and private sector fueled progress to actually move the needle and make some change. Wendy, I think you represent a very important role as a patient advocate and someone who can actually truly speak for what's going on for so many people out there. As a patient advocate, someone who's living with lupus, someone who works for a foundation, how have you seen patient education change over time? Is access to the internet helpful, or is it overwhelming? Can you just give us a little bit of perspective in that area?
Sure, thank you for that question. Education is now at our fingertips. So the internet, our whole move with technology, all of our advances, we've been able to advance as well in patient education and educating family, friends, and all of those around us who may have an interest in lupus. I will say on the downside of it, we still battle miseducation as well. With social media and everything. So we do love to encourage people to find credible resources like the Lupus Foundation of America, like what is going on just at this moment. So, I think that's been something that has definitely allowed us to reach more people, to reach people who can even learn in private, because sometimes there's a stigma and sometimes people aren't comfortable making the first steps. So they can learn in private. So it has been growth there.
And Sherrita, I saw you nodding your head when Wendy mentioned misinformation, and I, in solidarity, am nodding my head with you because it plagues so much of what we're trying to do.
It's what Wendy, I'm a fan of Wendy. I've worked with her for a little bit now. And yeah. I would say that two things she said that I thought were really, really key, which was more so around finding trusted information, credible information in places where patients can go and receive that. And for me, working for GlaxoSmithKline and also being a clinician myself, that has been an area that I have seen as a gap for many, many years. And lupus is just one of the other disease states. But working collaboratively with advocacy organizations and with physicians and also with industry is going to be so critical and important to ensure that we're all working hand in hand to create that safe environment where patients can go to receive education and information. So I agree with Wendy's point that it really does take a village.
And Sherrita, on that note, can I ask you what the role of industry specifically is in addressing these gaps in disease state education? You mentioned GlaxoSmithKline. I was wondering if you could give us an example of something industry is doing to specifically say, hey, we are going to address this piece of information or access to education, anything.
Well, I think the great part of working for Glaxo is that we have been in the lupus space now for nearly 13 years or over a decade. And for us, the stories that we've been able to hear, the clinical trials and the research that we have engaged, we've engaged many patients and we've heard their voice. And but what we know for sure is that the numbers are staggering. We know that 10 to 15% of people with lupus will die prematurely. I mean, we know it's hitting our youth, the future of our youth, with approximately 50 to 75% of children with lupus will develop kidney failure within the first 2 years of their diagnosis. So we have to operate with a sense of urgency as one lupus community, and that includes all of us, and really thinking about how can we work collaboratively together to achieve that. So I think with industry, to sum it all up, as a clinician and as an advocate for patients, we have to commit to go beyond the medicine, to change the numbers and the health disparity gaps that exist. We have to go beyond working in silos and work collaboratively as one. And so at Glaxo, for the last 10 years, we've been seeking ways to partner with our advocacy groups at the national level as well as at the community level to close these particular gaps. We began to say, patients feel very isolated, especially at post-COVID. They feel very isolated. So creating an environment where they can come and be safe, and social media or via digital platforms where they can come and learn. I can tell you, in working with Wendy and the Lupus Foundation, and many of we work with over 90 advocacy groups, that during COVID, the advocacy groups have pivoted very nicely to create a digital environment and a community online where patients can come and still stay connected. So I think industry plays a key role there. And from our perspective, we've heard the voices of the patients, not just at the national level, but at the community level. And so we have deployed on our side, we have a team of community nurses that work very closely with our advocacy groups to go out and provide reparable, reliable, and consistent education in collaboration with our advocacy groups as well as with our community to close the gaps. But I think we have to be in for the long haul, and we have to be embedded in the communities that we serve. So I think industry plays a key role. We're part of the family, the tribe. So it's exciting to see where we're going in the lupus space.
Right on. And it has to be a multifaceted tribe because it's covering so much of what's happening. Dr. Janine Clayton, can I ask you a question? Because I think this is a very fascinating kind of primer of a question. How is lupus kind of representative of the overall state of chronic disease? How is it emblematic of chronic disease? And then the second part to the question, what do we know about why women are more affected than men, and what more do we need to find out?
Sure.
Sorry, it's a loaded question, but I know you got it.
So lupus is emblematic of other chronic diseases in that it affects multiple systems, and it can affect everywhere, head to toe, in the eye as well as the heart and other organ systems. So we need to deconstruct that and be able to study that at the organ level and at the organism or person level. So we need animal studies. We need to translate findings from those laboratory studies into clinical studies. We need to be responsive to those individuals who are affected by those diseases. and address the clinical care of those individuals. So from a beginning to end, idea to execution to care delivery, it's a multi-component issue. And your second part was about how women are more affected. We have known for a long time that women have a more robust immune system than men do in general. Women respond more vigorously to infections, and that can be a good thing for fighting off an infection, but that can be a bad thing if you can't turn off that immune response. And so for autoimmune diseases, we are attacking our own tissue, our own body, for an unknown reason. And many of those genes that control the immune system are on the X chromosome. And women have 2 X chromosomes, perhaps a double dose of risk for autoimmune disease, if you think about it that way.
And I want to ask just another part to that, Dr. Clayton. You know, mentioned in the intro, I do some work with Nova Now. We do a lot of reporting on chronic diseases and what people go through. And we specifically talked to several Black and brown women about their experiences in getting diagnosis, accessing healthcare regarding conditions such as lupus, but also with endometriosis, arthritis. And there is a disproportionate amount of women who are able to actually access care, actually be heard, and have their concerns be taken seriously. So I was wondering if you could comment more about women in minority populations having a greater disproportionate disease burden. What more can you tell us? What do we need to do? And after you mention this, Wendy or Sherrita, if you have any thoughts, I would love to invite you also to share some.
Absolutely.
Great question. And we know, unfortunately, that Black and brown women are more likely to be affected by lupus and other autoimmune diseases. And we also know that data indicate that quality of care is not always consistent and does not always meet the standards. When we have treatment guidelines because of individual factors, perhaps discrimination at the level of care delivery, or institutional factors that unwittingly result in women not getting the care that they need or deserve, everyone doesn't get the care that is necessary to address their disease, But we also know that certain voices may not always be heard in the healthcare setting. So we want to do everything we can to address this at the provider level, at the institutional level, and community-based organizations, patients, advocacy groups. Any way we can raise awareness about this are some of the strategies that can address these problems.
Yeah, I think you're bringing up amazing points, because what we know for sure is that the prevalence of lupus in women of color is definitely the highest. But when we start to dig in a little bit more, we began to see that it's taking double the amount of time for a woman of color to be diagnosed with lupus compared to their counterpart. And so, you know, we've begun to dig into that a little bit more in our community advocacy efforts, and are really looking at social determinants of health, right? And how that plays a role. So as we look at the specific tactics that we deploy at the community level, how do we do more strategic advocacy work, more customized advocacy work that really seeks to close the gaps for that particular community? And so I think this topic is important, but when we look at the empowered patient, and most of the patients that I've engaged with that work with the advocacy groups are a lot more empowered patients, because they've already said, I'm going to this advocacy group and I'm taking control of my healthcare. But there's that unempowered patient that doesn't have the time or the energy or the money to go out and engage with advocacy groups. Those are the patients that we are really working to really try to support through our focus on patient unmet needs in certain communities. We focus on 70 communities. But programs, how do we advocate and collaborate together to close these gaps and create customized programs that will pull patients out and get them empowered and talking? And so we know the data, we know the numbers, but how can we begin to move to action in these communities? There's a program looped in on lupus nephritis by the National Kidney Fund, some really key campaigns out there that are really great work that we've had the pleasure of working with our advocacy groups to create. But how do we go from taking the data and the content that we know and the facts that we know to moving to action in a timely way to change the health disparities that we see? And I think that is the biggest challenge and the biggest question, I think, today, right? So.
Mm-hmm. I'll chime in too about the patient, with the patient experience. Something I've been doing last week in our national education event, I incorporated the discussion or just the introduction of implicit bias, just so people know that it's real. And we polled the audience, and some people didn't even know what it was. So a lot of times you're going to the doctor, you're having these experiences, you feel left out or shut out or not heard, and you don't even realize it's even a term or an actual action. So I just wanted the community to know that this does exist. This is what it's called. And this is how you need to take steps to battle that and overcome that. So I think just recognizing that there is a difference when it comes to minority communities is a big first step. Also, something that I've done just when looking at peer-to-peer discussions, I now try to incorporate something that says, as a minority person, you don't have the luxury of waiting, the luxury of not being a little more aggressive. So as an advocate, the minority community always has to work a little bit harder because there are barriers before them that could even be the difference between life and death. So those are some things that I'd like the community to think about as they do self-advocacy or advocate for others.
And Wendy, I want to stick with you and ask you another question, because we're talking about advocacy and how important it is when it comes to policy and outreach, but also there are potentially some genetic differences and some differences that make certain populations more susceptible. And on that note, I wanted to ask you about diversity in clinical trial research and what your thoughts are specifically with lupus. How are we doing now? What's new? Where do we need to go? What more work do we need to see? Could you elaborate any thoughts you have on that? And then after that, I would love to hear thoughts from both Janine and Sherrita about this as well, because this is obviously paramount in terms of new treatments, access to treatment, all of it.
Yes. So I'm very happy to share that, at the Lupus Foundation of America, we are honed in on this. We actually have quite a bit of funding and work from the Office of Minority Health. We have a specific program called LRAN for short, and another grant called Impact Plus, which focus specifically on educating the Black community, especially on the importance of clinical trial participation, educating peers to communicate and talk about overcoming these barriers. And one of the things that I just was thrilled to see in our work was actually talking about the history and why people are afraid to participate. There's a huge mistrust based on the history of the community, why people don't want to participate in a clinical trial. So something that I am so happy to say is, and I shared this with Janine and Sherrita in my conversation, and as I help educate others, is science isn't where it used to be. This is something really important for our community to know, and how the process flows when it comes to clinical trials and the goal, because we know genetically, and I am a witness to this in my own care, that often standard of care doesn't work well or work at all when it comes to certain populations. And so if we need this participation, it's really important to increase the comfort. And as I mentioned, science isn't where it used to be. And I gave the analogy that it's not like the Wizard of Oz. It's not this little man behind the curtain, running all the show. The patient has the power. I have the power as I participate in a clinical trial. And I think that's really important for patients to know, and to know how to navigate that, to work with the people who are able to explain things from step to step to step as they go through the entire process, to know how they're contributing and to also look back and turn around when patients participate in clinical trials and inform them how they made a difference or how they helped or what was this about, because a lot of times people give and they're not really sure how they impacted that. Knowing that little piece will allow people to tell others that, you know, this is what I did. Maybe you could do it too. And so those are some of the things we do have, those programs to increase those discussions to help the movement among peers, because we know when we talk to someone else that's like us, it increases the likelihood of people participating.
Dr. Clayton, what are your thoughts about all that? Also, I'm curious, as a practitioner, have you seen progress in terms of patients from different backgrounds asking about clinical trials, wanting to get involved? Have you seen more diversity?
So I would say on my side, yes, we are seeing more engagement as we have plans across the industry of how we plan to increase our ability to bring awareness to clinical trials. Simple things, right? You meet people where they are. Clinical trial enrollments that may be virtual, that do not require the patient to come into the office. Working with our historically Black colleges and medical schools and nursing schools affiliated with those HBCUs to begin to start educating where people actually, in communities where people actually within that community where there's already built-in trust. Barbershops, sororities, fraternities, really advocating and bringing awareness where the patients are at churches, right? And so I think that building the trust part up is critical to the success of getting the enrollments that we are seeking to achieve. And so we are seeing improvements. I believe that I love the quote Maya Angelou, you know, the quality of your intent will show in the end. If we got to put the efforts where we believe we ultimately want to be. And so I know at Glaxo, we have a whole department that is dedicated to diversity in clinical trials. And they have done a phenomenal job with outreach, but we have to meet people where they are. We can say all day that they're not empowered, they're not trusting. But I do believe in mentorship, and I do believe in meeting patients in the community and letting them see you eyeball to eyeball. And it's amazing how that builds trust for communities. And I would say even, we haven't spoken about the Hispanic community as well, having people who can actually deliver the education and information the way they need to receive it and in their native tongue and language, right? We've seen, you know, it's better to market to different communities differently, right? Word of mouth is more important in the Hispanic community. And so that trusted word to word conversation is a lot more impactful when you take that approach. So customized advocacy, precision advocacy, and really ensuring that we're understanding the patient. Trust will come along with those approaches. So that's what I've seen. So.
Along those same lines on our end, we are ensuring that we're supporting pathways to do just what Sherrita mentioned. So we're supporting research that allows, for example, you to use telenovelas delivered through Facebook to reach the Hispanic community in an HIV/AIDS study, because that was found to be effective for that population, that age group, and that study. Or all of our efforts in COVID, where we have partnered with trusted communicators, as Sherrita mentioned, and provided the funding through our SEAL initiative to get the money to the community organizations that are closest to the individuals affected, and to include them as partners from the outset when we begin a study. Or some of our transformative health disparities work that we are doing now, where we are engaging the community through listening sessions up front, again, designing steps for the community to be involved. And I'll end, Dr. Patel, with the fact that we're now also sharing more data so that you can see where the data lie. So on our RCDC inclusion website, we show you the number of women who are enrolled in the study. We show you the number of underrepresented groups who are enrolled in specific disease categories. And efforts like the NIH All of Us program are specifically focused on including those underrepresented in biomedical research.
Something I'd like to highlight is about that is at the Lupus Foundation of America, we have a program called RAY, which stands for Research Powered by You. And this has shown another option for those that might not qualify for a clinical trial, but might want to be involved. And I always say, for those that might not be ready to participate, you can do something to contribute from the comfort of your own home. We're collecting patient experience data through this program. And by this, people are able to share their day-to-day experience, how lupus impacts them. We're collecting things like, the experience of diagnosis, their quality of life, their symptoms. And this helps inform our researchers about things that could definitely benefit drug development and continued research.
Wendy, you literally read my mind. I feel you. I promise anyone viewing right now, we didn't cheat. I didn't know what I was going to ask, but I was legitimately going to ask you if the Lupus Foundation of America and the Office of Minority Health has played an important role in getting patients to truly understand the process from their perspective. So thank you for talking about that. And then that leads me into asking Sherrita the exact same question, but with industry is, I understand the importance of treatment and reaching patients with education, but what has industry done in terms of creating a relatable, positive image of a patient through their journey? Is there a place where a patient who may be newly diagnosed or wants more information about their family member can go and say, this individual looks like me. Here's how they did it. Here was their job. They're also a mother of a couple kids, and I can identify with them. This gives me hope. Is there anything like that you've seen, anything we're working on?
Oh, absolutely. And I would say it's been an approach of ours for the last 5 years, right? Industry's coming a long way. Like historically, industry would have a huge focus on advocacy. And what we have begun to see now, growth in the patient engagement component, right? So there's now advocacy and patient engagement teams that are stood up across pharma. It's one of the biggest growing areas, the largest growing areas within pharma, because you cannot just advocate. And this is, you cannot just advocate and provide funding at the national level and believe that it'll just trickle down to the local level. There has to be a patient engagement component that's embedded in advocacy teams across industry. And so GSK 6 years ago, we stood up a team that does exactly that, because we realized a more empowered patient, a more engaged patient and educated patient is one that will have better outcomes. And so we have to begin to develop teams, not just tools, but teams that can go out and work collaboratively with our advocacy groups to provide this level of education. I'm privileged to lead a team of nurses with over 100 years of experience, nurse practitioners mostly, that educate patients. But at the end of the day, we see the patients and wipe their tears, eyeball to eyeball, hugs to hugs, really going into the community level and getting insights and learning insights around the voice of the patient, and then developing resources, similar to what Wendy was saying, developing resources that are customized to the needs of the patient. So yes, industry's doing a lot. In the past, we did a lot of direct to consumer, a lot of commercials, on social media, those types of things, but there's nothing that replaces that contact with the patient that allows you to give a hug or to wipe a tear or to talk to a family member, as side by side. There's nothing that replaces that touch. And we're seeing now that in post-COVID, doctors and healthcare providers have less and less time to provide that level of education and information, and that our advocacy groups and our community organizations play an even more active role in ensuring that education is given to the patient in a reparable way. So I would say the industry is doing a lot. I would say GSK is doing a lot to support shared decision-making. Because of that lack of time that the physician has, it's important for the patient to come in informed and empowered and advocating for themselves, to be able to have a conversation with their doctors around what is ultimately best for them. But again, I go back to my point. It will require us all working hand in hand together to do that at the national level, but also at the community level. So yes, we're doing a lot of that, and we work hand in hand with our advocacy groups to ensure it's done in the right way.
Sherrita, the minute you mentioned that healthcare practitioners have less and less time for meaningful conversations, I kind of wish I had one of those like hype bullhorns, like pew, pew, because I was like, oh my gosh, that is such a true frustration, which brings me to a question I have for you, Dr. Clayton. You know, if anyone on the outside looking in looks at healthcare today, they will see a healthcare worker shortage, they will see burnout, they will see a disproportionate amount of healthcare practitioners, whether there are nurses, nurse practitioners, PAs, or physicians who come from an ethnic background. We will see a rural healthcare shortage. We will see a primary care shortage that's only worsening. And I'm trying not to, be a doomsday theorist here, but we're not heading into a great place. So when it comes to being able to reach patients, to have those meaningful conversations, especially when it comes to reaching vulnerable groups about chronic illness, autoimmune disease, and lupus, what are your thoughts? That's a loaded question, but what are your thoughts and what is the hope? What direction can we go to make sure that we are not widening the gaps in coverage moving forward?
Pick the easy question for me, Alok. I really love that.
I had to. It's such an important one.
Well, I am very cognizant, and as my panel members are, of the challenges that we are facing as a society. But I believe that science is best poised to solve society's problems. However, we need to address this in a comprehensive, coordinated, and connected manner so that research is partnering with industry and research are partnering with patients and strategic engagement and organizations like Research America on programs just like this to set the course for the future, where we keep the patient at the center. So instead of each of us, only thinking about our mission goals, as lofty and admirable as they are individually, unless we could work together in more creative, innovative, and contemporary ways, we are not going to deliver. And as you pointed out, our healthcare workers at the front lines need us as well in ways they have never needed us before. We see women in particular, women healthcare providers, women make up 70% of healthcare providers leaving because of burnout, as you mentioned. So platforms such as this that connect across sectors are so needed. And I'd like to see more of those integrated, interdisciplinary, patient-centered, forward-looking, solution-oriented platforms. And Sherrita's smiling, so I hope that means she's on board with me.
You said I asked you a really difficult question and you just dropped a TED talk without saying or like once. That was beautiful. That was not good. Scripted also. That was amazing. And you mentioned how many healthcare professionals are women. And I will personally tell you, as someone who still practices, I want to break a window when I hear from my female colleagues about the mistreatment and about not having paid maternity leave and all these things that we need to address when it comes to bridging these gaps. But, as a last question, maybe we'll spin it back to a little bit more optimism. I want to ask all three of you, one last very important question is, what excites you the most about lupus research and education moving forward? What is that one thing that you're like, this is actually great. This is where we're moving forward and why we're going to see progress in 10 years. Wendy, I'll start with you.
Man, just the power of the woman. This is a disease that impacts, 90% women. I was just thinking about how at my organization, how we're approaching this. And I was just thinking, wow, our particular program, LRAN, has over 50% women, minority women, to help with the conversation and the development and the push for the improvement of clinical trials. Education-wise, we've created a hub for people to learn more about clinical trials and become more empowered. And I can't say that enough. One of the big goals I definitely have as I work here is having a more educated and empowered patient, because it's really important for patients when they go into your room in that visit to know what they need, know how to answer the question, have a track record that they can say in a short moment to make the biggest impact. So, knowing how to do that and speak up for yourself and partner with industry, with doctors, and understand the big picture is really, really important. And that's what I'm excited about, because I see this happening already.
Yeah, I would say the beauty of what we've learned over the last 3 years and how that is so sustainable, and how it has really led to some insights that we probably have taken for granted or would not have stepped into if it wasn't for COVID. One is we've reached many more patients during COVID than we probably ever would have with our previous engagements. So the use of technology and digital to reach patients, to have really meaningful and impactful engagements, to begin to really pull out information and education that is more customized for that particular population. I saw more of that during COVID than I had in previous years. And while it was, at the end of the day, what we really need to begin to start looking at, and I think we're asking the right questions, and this came out of the use of digital and technology, the use of survey questions and asking patients more now, what do you need? What can we do more of? Now is resulting in, we have a baseline of what it is that they need. And now we're able to customize information that's specific for them. And we're also better able now to measure the impact of our engagements, right? Before we would just do it, everyone would leave, it was great. Now we can say, well, your score when you came in, you were empowered by 20%. When you left the program, you're now more empowered and feel more comfortable talking to your HCP. So more evidence-based education and resources and programming, I think, are coming out. And I'm really excited to see that, to say, I tell my team all the time, okay, you delivered an educational speech, you did great, but did you save a life? And now with the new technologies and resources that we have, did we move the needle? So if, God forbid, another disaster comes our way, we can say that what we did during this time, working hand in hand with industry, with advocacy groups, with churches, with communities, we can now say we were more prepared. And I think that ultimately is what we have. And I am just so excited about that piece. We just got to keep going, right? We got to keep going. So.
Piggybacking on my colleagues, I am so excited about our ability to accelerate going from ideas to impact. And that what is in between that ideas to impact, to me, is inclusion and innovation. Okay. By including more voices at every step of the way, from the first idea about what we should be studying and where we should be studying it, we've expanded the universe of potential solutions. By including more people and who participates in research and clinical care, we have more creative ideas and community-based ideas by having more different kinds of people. That drives innovation. So we have big data. Of course, I'm going to talk about technology, how important that is, but it's not important if you can't deliver it to the people that need it the most. So in order to go from idea to impact, which we are all trying to do here, inclusion and innovation. So those four I's: idea to impact, inclusion, innovation. That's what I'm excited about.
I wish I could slow clap, right? I mean, I can slow clap, I can do whatever I want, but this was incredibly inspiring. I so appreciate the three of you in taking the time to talk with us today, to give people that hope, teach people how to be inclusive, hear out patients, and move the needle. I encourage everyone out there watching to look up these three incredible women, read about their bio, their work, to learn more. Thank you all so much again.
You're welcome.
Thank you.
Thank you.
Well, thank you. Thank you, everyone, Dr. Patel, for leading a really energetic and, I think, as you just said, inspirational panel. It was absolutely terrific to listen to.